Good afternoon. I got a notification that we had a patient come in with a possible eye infection or a reaction to something possibly chemical. Okay, all right. Well, I do see that your eyes are very swollen, so before we get into the details, let me just take a quick look at you. Can you tell me what happened or what you think might have happened? I know that the cold and the flu are currently going around, so I wouldn't be surprised if it's something that is viral or bacterial. But it looks like you have a little bit of other breakouts. Looks like maybe hives. Is your nose and your respiratory system congested? Okay. Is it painful or is it just annoying? And how about the ears? Do the ears seem irritated at all? Do they hurt? They do? Okay. Alright. I'm going to take a look into your eyes real quick, if you don't mind. Look up and away. Does this light hurt? Yeah, your eyes are definitely swollen. And your dilation is a little bit delayed. You do have a fluid that is coming out of your eyes. And just in case this is something like a reaction to a toxin, I'd like to take a swab of it and see if we can send it off to the lab for further analysis. Do you mind looking up for me? I'm going to take this cotton swab here and very, very gently touch the waterline of your eye. Okay, look up for me. I'm going to do the same but with the other eye, okay? Go ahead and look up. Okay. All right. I'm going to take a look into your nose because I can hear you struggling to breathe a little bit. Do you mind if I tilt your head back just a little bit so I can look into your nose? Do you have any allergies or anything that you react to or sensitive, such as pollen, any kind of cleaning chemicals? Okay. I might take a swab of what's coming out of your nose as well, if that's okay. So just go ahead and keep your head up for a second here. This might tickle a little bit. Okay, go ahead and look down for me, hon. Do you mind if you open up your mouth here and say ah? Ah. Can you slide your tongue to one side? And now the other? Okay. I'm going to check your ears here real quick. Just turn your head here so I can take a look into one ear. Do you regularly clean your ears, or do you ever stick foreign objects into your ears, such as pencils or toothpicks or anything like that, any sharp objects? Now the other side. Okay. Your ears are also swollen. This is something that I would typically suspect with any kind of like anaphylactic reaction. The fact that you also have hives and that you look like you're fairly swollen around the neck here. Are you able to breathe and supply adequate oxygen? Do you feel lightheaded or anything? You feel like you have a headache, but nothing like dizziness or off balance? Okay. Well, I think that the eyes are primarily the main organ that's struggling here, so I'm going to, with your permission, use a little bit of sterile saline and just flush your eyes out a little bit. I'm going to tilt your head back and I'm just going to drip a couple of drops into your eyes, and I want you to blink a couple of times and let that fluid go out the sides of your eyes, okay? So go ahead and please tilt your head back for me. Okay. Now sometimes it helps to look away from where the drops are coming. Okay. Now blink for me. Okay. Now look into the other direction. Okay. Go ahead and look down for me, hon. I'm going to help to clear this out a little bit. I want you to look up for me, and I'm going to take the Q-tip and run it along your waterline. This is just to drag any of the material out of your eye, if you still have any, okay? I'm going to do this very lightly, very, very softly. Okay, now I'm going to do the other eye. Tilt your head back for me. We're going to do a couple more drops. Okay. And a couple more on the other side. Go ahead and blink it out. Tilt your head back down. Gonna do this again. Look up. Go ahead and blink if you need to. Get better. Okay. Does this feel cool and good, or does this feel like it burns? Okay. Well, I'm going to take a look at some of your other organs, and that way, if you have anything else that's going on, we can start to address that. In the meantime, give your eyes just a little bit of a rest and see if that clears up. Okay. You have a little bit of debris in your ears. So I'd like to see whether or not I can get a sample of that, and also to kind of clear it out and take a better look at it. Is that okay? Do your ears itch? Okay. I'm going to go have you look to your right. And I'm just going to look back into your ear here. Cotton swab, just to start and pull out. have a blockage. I'm going to take some tweezers. I'm going to be very gentle by using these, but I'm going to see if I can pull whatever is lodged in your ear out, okay? This can sometimes tickle. We're going to just clean off our tweezers in case your ears don't have the same bacteria or whatever this is that's going on. Just going to dose that rubbing alcohol real quick to make sure we don't do any kind of cross-contamination. Alright, let's take a look into your right ear here, if you don't mind. Definitely have an infection going on into your ears, but it doesn't look like it's getting to be a problem. Your ears are inflamed, but I don't think that it's as serious as what's going on with your eyes. I don't think the two are related necessarily. You ready for some more drops? Okay. Go ahead and just tilt your head back when you're ready. Oh, go ahead and blink. Okay, tell me when you're ready. Okay. Okay, do the same with your right eye. Tell me when you're ready. Go ahead and look down for me and blink. And now I know that this can often cause tears. Just go ahead and let them stream down, okay? Okay. I'm going to do the trick with the cotton swab. Let me know when you're ready. Just go ahead and blink. Okay. Are you having any difficulty focusing on objects? Any blurry vision, double vision, change in color? You think this might have been a chemical exposure? Why do you think that? Okay. Do you notice if any of your other senses feel off? Do you feel like you're out of breath? Do you feel like there's any, your heart rate has increased? Anything like that? Possibly? Okay. I'm going to take another quick look at your eyes and see if there's still any kind of that mucus film. Okay. Yeah, your dilation is a little bit slower than normal responses. That sometimes can happen with exhaustion or any kind of neurological influence. How have you been sleeping? Not very well? Okay. Your eyes okay for a couple of moments? Okay. Let me just take some basic health measurements here. I'm going to place this on your chest here. And just breathe normally. Okay. I'm going to place this on all 4 chambers of the heart. So I'm going to start right here on your chest. Okay. And can you lift up your arm a little bit for me? And then your second chamber can be heard usually on this side. Okay. All right, and now lift your arm up a little bit higher here. Okay. Just breathe normally for me. You feel a little out of breath? Okay. Just breathe in deep and try to relax. Okay. And now on the inner side of your left breast here. Okay. I'm going to use the sensitive side here. I'm going to place it on your clavicle on both sides. I want you to breathe in for me deeply and exhale, okay? And out. Okay. And again. Okay, I'm going to go a little bit lower. Go ahead and breathe in for me. And again. Now the bottom portion of your lungs. In again. One last time. Okay. You sound a little bit congested, but nothing that is coming out like a cough or any kind of blockages. Do you feel like you're able to get enough oxygen? Okay. Okay. I'm going to feel your lymph glands on the sides of your face and your throat and your clavicle, okay? And if any of these areas feel tender, let me know. Right here. Have you been experiencing pain in this area just recently? Okay. What about here in the front of your neck? No pain? Okay. I'm going to pinch a little bit on your neck here. This should not hurt. It's not going to feel all that comfortable, but it shouldn't hurt. Okay. I'm going to tap on your chest a little bit here. Again, let me know if there's any pain. Mind lifting up your arms a little bit for me? I'm going to feel underneath your armpit here and along your side, along your pecs. We have a lot of lymph glands that meet in this particular area. Does any of this feel tender, like it's swollen? Okay, it does. Okay. Back up to your neck here. Okay. I think you might be having a slight anaphylactic reaction. It's not something that is a terrible reaction, nothing that we need to do like epinephrine for, but I'm going to give you some Benadryl, and that should lower the symptoms in the congestion, also in the pain, and you're going to want to stay very hydrated for the next couple, I want to say 24 to 48 hours. Drink as much water as you can stand to help flush this out of your body. Okay. I'm going to focus again on your eyes because your eyes do still look like they're swelling and they are very, very irritated and red. I think whatever you might have come in contact with, your eyes were definitely the most subjective. So go ahead if you're ready for it. Do you mind tilting your head back again? Okay. Alright, let's hope that this can flush it out and get you more comfortable. Blink, hold your eyes shut for a moment, and let that drain out. Okay. Alright, I'm going to do one more. Drops on your right eye. Blink it out. Blink, blink, blink. Alright. And one more on your left. Ooh, okay. Alright. Go ahead and tilt your head down here. Go ahead and rub your eyes if you need to. One more time with the cotton swabs. Let's drag as much of that material out as we can. It's starting to feel a little bit better. That's good. I don't see any kind of debris, no objects or dust or anything like that. I do see that your eyes are definitely swollen. Yeah, it's probably just a reaction though. Do they burn still? You think it's just swelling? Irritation? Okay. Alright. I'm going to lift your eyelids here. I want to look up into the back of your eye and look at the blood vessels that go back, okay? Go ahead and look away. Okay. Now the other eyelid. Just going to lift your eyelid up. want you to look straight at my nose here and let me know when you see my finger wiggling without looking at my actual hand, okay? Okay. Same on this side, just look at me. Okay. So your peripheral vision doesn't appear to be affected very much. That's always a good thing. Okay. I'd like you to have a look at the light. Now the light might be very bright, but I'd also like to see if you can follow it, okay? Now I'm going to bring it in close to you, and this is going to be a little bit of a strain. Okay, you're struggling to do that? How is your focus? Are you able to see how many digits I'm holding up? Okay. Now I'm going to back up a little bit. Does this look like a sharp object? Can you see the sides of the cotton swab, or are they fuzzy? And how about now? Blurry. Okay. Are you seeing double vision maybe? You're struggling. Okay. Alright. Well, if this was a chemical-induced type of anaphylactic reaction, this is not uncommon. Your neurological system is struggling to interpret what your eyes are not capable of focusing on. That includes dilation. So we're going to get you some Benadryl, and we're going to get you some sedatives, put you in a dark room, and I'd like to have you rest for a lengthy amount of time. Let your body heal, flush whatever toxin is in your system out with a good amount of water. Tea is also very good, and hopefully this will pass within the next couple of days. But I'd like to schedule in another more focused exam in say 2 to 3 days, and that way we can test your vision. We'll see whether or not there's any kind of repercussions or damage. Also to check the capillaries and the veins in the back of your eyes and see whether or not you're still suffering from something. Okay. The Benadryl will help immediately with those symptoms, as well as your breathing and the tenderness in your neck and your lymph system, okay? Alright, we'll schedule you in. We'll see you in a couple of days. In the meantime, I'll have the nurse bring you in some meds. Okay. Alright. Take care.